Infant's bath. First is to wash your hands and gather all the equipments. This is to save time, effort, and energy. Explain the procedure to the mother. This is to reduce the anxiety. Check the temperature of the infant. The normal of the temperature ranges from 36.5 degrees Celsius to 37.5 degrees Celsius. Also, adjust the water temperature. Make sure to use the dorsal hand side of the palm and the elbow because this both is sensitive to the temperature. This is to prevent burning the infant's skin. Undress and wrap using the mommy restraint the baby. This is to bat the head portion first and to prevent unnecessary movement of the infant. Do the football hold. This is to prevent the baby from falling. And also fold the outer ears using the thumb and the middle point finger. This is to prevent water entering the ear and also to avoid ear infection. Wash the head first with soap and water and rinse thoroughly. For the soap, we use mild soap only necessary if prescribed by the doctor. Dry the head thoroughly and immediately in a circular motion. This is to prevent chilling for the baby or the infant. Upon removing the diaper of the baby, make sure to place the baby on the crib. This is to prevent falling of the infant and make sure to support the baby's head and neck with the hand. Wet the entire body from the farthest arm, chest, abdomen to the nearest. Make sure to soap and rinse the entire anterior portion of the infant's body. Turn the baby in a prone position. Make sure to hold the baby in the dominant hand supporting the chest and the forearm, and the free hand should using to rinse the baby's back. Wet the entire back portion of the infant's body. Soap the nape first in the posterior aspect of the infant's body in a circular manner, and soap farther lower extremities and paying attention to the popliteal area, and do the same on the nearer lower extremities. The buttocks and genital areas are cleaned last. Make sure to remove any fecal material using the tissue paper. Rinse thoroughly the entire posterior portion of the baby's body and place the baby in a supine position and rinse thoroughly the baby's body. Place the baby back to the crib and pat dry the entire body using the baby's layette. In procedure 21, apply new diaper to the baby. Dress the baby with a new shirt and wrap the baby with dry clean layette. This is to provide warmth and comfort for the baby. Also comb the hair of the baby using a baby brush. Make sure that the brush is soft. Umbilical cord care. The first procedure is to wash your hands to prevent contamination towards the baby. Next is to expose the umbilical area. Make sure to explain the procedure to the patient or the mother. While dropping the sterile water or the alcohol to the umbilical area of the baby, make sure to cover the genitalia or the circumcision stump if present. Soak cotton buds or pledget on the alcohol or isopropyl or the NSS solution. For cleaning the umbilical base or the umbilical stump, make sure to do the inner to outer in a circulation manner. This is to prevent infection. And if it's moist, fold the diaper. For dropping the sterile water or the alcohol to the umbilicus, make sure that there's no dripping on the genitalia. The rationale here is not to irritate the sensitive part of the infant. For the ninth procedure, let it dry the open dressing. And remove the cord clamp after 48 hours. Make sure to place the baby on the crib at the right side lying position and do the aftercare. And after that, wash hands. For recording and charting, make sure to take note the time bath is given, the signs and symptoms observed, and also the baby's condition. Feeding and burping assessment. The equipment will be needed is the bottle cup and the feeding bottle. The first procedure is to wash hands with clean water and soap. The rationale for this is to prevent the spread of microorganisms and contamination towards the baby. The third procedure is to wrap the infant warmly and to hold the infant in a slight Fowler's position. The fourth procedure is to place the entire nipple on the infant's mouth, and the fifth procedure will be filling the entire nipple with baby formula. The sixth procedure is to place a diaper under the infant's buttocks and on your lap, and also the seventh procedure is to burp the infant. Position the baby sitting on the lap with the base of the hand supporting the chest of the baby. Cup the chin using the thumb and the index finger and gently pat and rub the back of the baby. Do aftercare and after that, wash hands. For charting, take note of the time when given, the amount taken, the condition of the baby, the sucking reflex, and the signature.